Oral cancer, often called mouth cancer, can affect any part of the mouth, from the lips to the tongue, gums, or even the roof and floor of the mouth. Early detection is key to successful treatment, and today, we're going to cover the signs to look out for. One of the first signs of mouth cancer is persistent sores or ulcers that just don't heal. If you've noticed a sore spot in your mouth that has lasted more than 2 weeks, it could be time to get it checked out. Persistent sores or ulcers in the mouth that don't heal are among the most noticeable early warning signs of mouth cancer. Here's a deeper look into how these sores differ from regular mouth ulcers and why they're significant. Appearance and duration. Normal mouth ulcers, like canker sores, are typically small, round, and usually heal within a week or 2. In contrast, cancerous sores or ulcers tend to persist for longer than 2 weeks without showing signs of healing, even with standard home care. Location. These sores can appear anywhere in the mouth, on the gums, lips, inner cheeks, roof or floor of the mouth, and even on the tongue. Sometimes they may even develop in less visible areas, such as the back of the mouth or throat, making them harder to spot. Texture and sensation. Cancerous sores may have a thickened, rough texture and feel slightly firm to the touch compared to typical mouth sores. These areas might be painful or numb, depending on their location and the stage of cancer. Some people report a burning sensation or unusual discomfort that doesn't improve over time. Color. While many mouth sores are red, a cancerous ulcer may appear as a red or white patch or even have mixed coloring. Red patches, known as erythroplakia, are more likely to be linked to cancer, as are white patches, leukoplakia, especially if they have a rough or hardened surface. Bleeding. Cancerous sores or ulcers may bleed more easily than regular sores, particularly when touched, brushed against, or when eating certain foods. Unexplained bleeding in the mouth, especially from sores that don't heal, is a sign to seek medical attention. Other accompanying symptoms. Persistent sores might also be accompanied by other symptoms such as difficulty swallowing, changes in speech, and a swollen sensation in the mouth or throat. Red or white patches inside the mouth or on the tongue are another early warning sign. These patches can sometimes feel sore or irritated but often appear without any pain. Red or white patches inside the mouth or on the tongue, known as erythroplakia, red patches, and leukoplakia, white patches, are significant early indicators of possible mouth cancer. These patches differ from typical mouth irritations and can signal changes in mouth tissue that should be examined closely. 1. Appearance and location. 1. Leukoplakia. White patches in the mouth or on the tongue can look like flat or slightly raised areas with a thick, rough texture. 1. They may be found on the gums, cheeks, or tongue, and often feel leathery or hard. 2. Erythroplakia. Red patches appear bright red and often have a velvety texture. 2. They can be more alarming because they have a higher likelihood of being associated with cancerous or precancerous cells. 2. Persistent and unchanging. 1. Unlike spots from minor irritations that resolve after a few days, these patches tend to persist for weeks or even months without fading, despite avoiding triggers like tobacco or alcohol. 3. Pain or discomfort. 1. Often, leukoplakia patches are painless, which can make them easy to overlook. 1. However, some people may experience mild discomfort, irritation, or sensitivity when eating spicy or acidic foods. 2. Erythroplakia patches, on the other hand, are more likely to cause discomfort, tenderness, or a burning sensation. 4. Risk factors and causes. 1. Risk factors for these patches include smoking, tobacco use, heavy alcohol consumption, and chronic irritation, such as from ill-fitting dentures. 1. However, they can also appear without any obvious cause, so even non-smokers and non-drinkers should be vigilant. 5. Irregular edges and changes over time. 1. Cancerous or precancerous patches might have irregular, undefined edges or areas with varying thickness. 1. If you notice a patch growing in size or changing in texture or color, it's important to seek medical advice. 6. Importance of early evaluation. 1. While not all red or white patches are cancerous, persistent ones should be evaluated by a healthcare provider or dentist. 1. Often, a biopsy is recommended to determine if abnormal or precancerous cells are present. If you're experiencing unexplained numbness, pain, or difficulty moving your jaw or tongue, it's worth mentioning to a doctor or dentist. Mouth cancer can make swallowing, speaking, and chewing harder over time. Unexplained numbness, pain, or difficulty moving the jaw or tongue are concerning symptoms that could indicate early stages of mouth cancer. These signs are often related to nerve involvement or tumor growth that interferes with normal sensation and movement in the mouth. Here's a closer look at each of these symptoms. 1. Unexplained numbness. 1. Loss of sensation. This can feel like a persistent, pins and needles, or tingling sensation, especially in areas like the tongue, lips, cheeks, or other parts of the mouth. 1. It may occur suddenly or develop gradually. 2. Local areas are widespread. Numbness might be limited to a specific area, such as one side of the tongue, one cheek, or part of the lips, or it can be more widespread. 3. Nerve compression. The numbness usually happens when a tumor puts pressure on or damages nerves within the mouth or jaw. 3. This compression can disrupt normal nerve function, leading to altered sensations. 2. Persistent pain. 1. Localized or spreading. The pain can be confined to one spot, like a sore area on the tongue or jaw, or radiate, making other areas, like the ears or throat, feel painful. 2. Associated with swelling. Swelling can add to the discomfort and make speaking, eating, or swallowing more painful. 2. Pain might also worsen with movement, such as when chewing or yawning. 3. Not relieved by common remedies. Unlike typical mouth sores or mild dental pain, this pain often doesn't respond to over-the-counter painkillers and persists over time, even when avoiding hot, spicy, or acidic foods. 3. Difficulty moving the jaw or tongue. 1. Stiffness and limited mobility. Some people may find it difficult to open their mouth fully, move their jaw from side to side, or extend their tongue properly. 1. This stiffness can make it challenging to chew food, speak clearly, or perform other basic movements. 2. Locking or restricted movement. Tumor growth near the jaw joint or muscles can lead to restricted movement or locking of the jaw, which can cause difficulty with everyday activities like talking or eating. 3. Speech changes. Difficulty moving the tongue might alter speech, causing slurred words or a change in how certain sounds are pronounced. 4. Difficulty swallowing or a lump sensation. 1. Trouble swallowing. Tumors in the mouth or throat area can create a sensation of something stuck in the throat or make swallowing uncomfortable, leading some people to avoid certain foods. 2. Lump sensation in the mouth or throat. In some cases, there may be a feeling of a lump even when nothing is visibly present. 2. This sensation often occurs if a growth is pressing against surrounding tissues. 5. When to seek help. 1. If these symptoms last for more than 2 weeks without explanation, it's important to consult a healthcare provider. 1. Persistent numbness, pain, or mobility issues in the mouth are not typical and may require further examination, often including imaging or a biopsy to check for cancerous cells. Lumps or unusual thickening in your cheek, gums, or any other part of your mouth can also be an early sign. While many lumps are harmless, it's always best to get them examined. Lumps or unusual thickening in the cheek, gums, or other areas of the mouth can be one of the early signs of mouth cancer. These lumps differ from common mouth injuries or benign growths and are often more persistent, resistant to healing, or associated with additional symptoms. Here's a closer look at what to watch for. 1. Appearance and texture of the lump. 1. Firm or hard mass. Cancerous lumps often feel firm, hard, or rough to the touch, and they don't move easily. 1. Unlike softer, benign growths like mucosales, fluid-filled cysts, cancerous lumps may feel fixed in place. 2. Unusual thickening. In some cases, instead of a distinct lump, you may feel a thickened area of tissue on the gums, cheek, or roof of the mouth. 2. This can feel like a rough patch or hardened area that doesn't match the surrounding tissue. 3. Size and growth. These lumps may start small but often grow or change over time. 3. Any lump or thickening that increases in size, especially over weeks or months, should be evaluated. 2. Location of the lump or thickening. 1. Common sites. Mouth cancer lumps are commonly found in areas like the gums, inner cheeks, tongue, floor of the mouth, and roof of the mouth. 1. In some cases, they can also appear in less visible locations, such as the back of the mouth or near the throat, making them harder to detect. 2. One-sided appearance. Often, these lumps or thickenings may be present on only one side of the mouth, rather than being symmetrical. 3. Associated symptoms. 1. Pain or discomfort. While not all lumps are painful, cancerous lumps can sometimes be tender to the touch or cause persistent discomfort, especially when eating, chewing, or talking. 2. Bleeding. Some lumps or thickened areas might bleed easily when touched, brushed against, or irritated by food. 2. Unexplained bleeding in the mouth, particularly from a lump or thickened area, is a reason for concern. 3. Difficulty swallowing or moving the jaw. If a lump is pressing against other parts of the mouth or throat, it may cause difficulty with swallowing or restricted jaw movement, making it harder to perform basic actions like speaking or eating comfortably. 4. Appearance of the lump. 1. Discolored areas. Some lumps or thickened areas may have a different color than the surrounding tissue. 1. They may appear white, red, or even dark in color. 1. Red, erythroplakia, or white, leukoplakia, patches on or around the lump can also be warning signs. 2. Irregular edges. Cancerous lumps may have irregular, uneven edges, unlike benign growths, which are usually more rounded and smooth. 5. Other risk factors to consider. 1. Lifestyle factors. People who use tobacco, drink alcohol heavily, or have a history of HPV, human papillomavirus, infection are at a higher risk for oral cancers. 1. If any lump or thickening appears in individuals with these risk factors, it's especially important to seek an early examination. 2. Persistence over time. While some mouth lumps are benign and may resolve on their own, any lump or thickened area that lasts more than 2 weeks, grows, or changes in appearance should be assessed by a healthcare provider. 6. When to seek medical advice. 1. It's essential to consult a healthcare provider or dentist if you find a lump or thickened area that doesn't go away within 2 weeks, grows in size, or causes discomfort. 1. A biopsy or further examination may be needed to determine whether the tissue is benign or if it shows any precancerous or cancerous changes. Early detection saves lives. Regular dental checkups and being proactive about unusual changes in your mouth can make all the difference. If you notice any of these symptoms for more than 2 weeks, don't wait. Reach out to a healthcare provider to discuss your concerns. Your health is worth it. Let us know in the comments, and don't forget to like and subscribe for more health tips.